Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you how to do a prone quadricep stretch either before or after knee replacement surgery. So the important thing to think about with this activity or this stretch is it's really a stretch for the muscles. So in particular, a stretch for one of your quadricep muscles called the rectus femoris. So that's a big muscle, one of the muscles of your quadricep. It crosses your hip joint and it also crosses down at your knee joint. So the limiting factor for this is really going to be the flexibility and stretching of that muscle rather than specifically focusing on the range of motion at your knee joint. So you may notice with this activity that you might get less range of motion in terms of bending of the actual knee, but you're going to feel that stretch, and hopefully that will carry over to some improved flexibility and improved tolerance with some other range of motion activities or other exercises that you may be doing. So what you need is a surface that you can lay down on, and I have a green stretching strap here. You can use a belt loop, you can use a dog leash, you can use a towel, bed sheet, whatever you have available. And what I like to do is have a little loop on one end of whatever you're using. So take that loop and you're going to put it around the ball of your foot, and then you're going to go ahead and lay on your stomach. And now all you're going to do is you're going to bring your knee, so bend your knee and bring your foot toward your bottom. At some point you're going to get to a sticking point where you feel like you can't really move it much further. And that's when you're just going to apply that moderate pull with the band to try to give yourself an extra little stretch. So you should feel a moderate intensity pull or stretch along that front part of your thigh. Now because this is a stretch, we're not going to do repetitions up and down, up and down. We actually want to get into this as far as we can, moderate intensity, and we're going to hold that about 30 seconds at least, and then slowly let it come back down. Now I like to do 2 or 3 repetitions, holding about 30 to 45 seconds each time, and just maintaining that moderate intensity stretch. And what you can also do to add a little bit more stretch or make it a little more intense is if you take a rolled up towel or a small pillow and you put it right under your thigh, right under that same leg and the hip and thigh area. That's just going to give you a little more extension of that leg and possibly give you a tiny bit more stretch as well. So that's prone quadricep stretches. A good exercise again for flexibility and stretching of your rectus femoris, your quadriceps and hip flexor muscles. If you found this helpful, I appreciate any likes. I appreciate the comments and questions below, and I'll be sure to get back to you. And please be sure to subscribe if you're interested in catching all my videos related to knee replacement surgery, exercises, stretches, range of motion, frequently asked questions, and everything else in between. Thank you very much for watching.